All right, so excellent. So thank you, Roger, for inviting me to this, and thank you all for waiting so long to hear us. So very briefly, we're Geneius, and as you'll see, we're working on something we call Smart T, which is T cells targeting mutations in cancer, which cause them. Very different from CAR T, which is genetically engineered. These are natural T cells and don't have any of the side effects and toxicities that you hear about with CAR T, but they're very effective. And we have a patented process to make these types of cells for all types of cancer. So as you can see, these green cells are pancreatic cells, and pancreatic cancer, very bad form of cancer, and the small cells are T cells. And what will happen here is after focusing in, you can see the cancer cell kind of with the little T cell attached, exploding it. And that's the goal of what we can do with Smart T, which kills only the cancer cells and never the normal cells at all. So how does it work? Basically, these cells, cancer cells, are abnormal and should be recognized just like any infection. And with Smart T, we can take 120 ml blood draw and educate the T cells in our patented bioreactor process to kill the cancer cells. Basically, this is a common process to make a custom product for people. It can be given in 2 30-minute infusions, and due to the minimal side effects, the patients at home with their families while the immune system takes care of the cancer. Really very, very much in a class of its own. The only one focused on community oncologists, where 85% of the patients are, as opposed to major cancer centers using RNA to prime the T cells. And the economics and affordable pricing allows us to price comparably to antibody drugs such as Keytruda or Opdivo with 80% margins, which is significantly less than any other T cell therapy around. So we use the RNA to educate the T cells by recognizing multiple mutations in cancer. And also to empower them, we have a circular RNA technology to add additional molecules into them, which can target the microenvironment and target barriers, which they may have. And then to enhance, really using also these same mutations to develop RNA vaccines to boost the T cell therapies. And really, when you think of cancer, it's really a two-step process. It starts with multiple mutations, particularly in the drivers of proliferation and differentiation, metastasis. And then there's a failure of the immune response, which eventually results in escape of the tumor. What we really do is reverse this process by targeting the multiple mutations and leading to elimination of the tumor once again by the immune system and having proper surveillance and memory. Really, in terms of our product, while we are a T cell therapy, we're very, very different in profile from TILs, TCR, T, and CAR T. We're very patient-friendly in terms of outpatient and affordable, really robust manufacturing. We have optimal function in terms of all the functions that you would want to kill the cancer. And we're customized, actually, for that individual's cancer, using all of the tissue types and the full genetic diversity of that person to focus in on the mutations that are causing the cancer. And we apply kind of a toolkit of IP that we've developed to do this, including RNA, the education, which I highlighted, also repriming and sorting, and optimal functions, and the various therapeutic delivery mechanisms, which I mentioned before with the RNA and the vaccines. What we do is we start in the local oncology clinic with 120 ml blood draw. That blood is then processed so we can sequence the circulating tumor DNA from the sample and get blood mutations. We can create then the RNA from that and use that in parallel to put into the teacher cells, the dendritic cells from the blood, which will teach the T cells what cells to attack. And then we multiply those into billions, freeze them down in 2 IV infusion bags. And then after a 4-week period of time, we can infuse in 2 30-minute infusions with saline and the patients at home in between with their family and living a normal life. So far the company has raised $15 million, which has developed the Smart T technology, patents in major markets, and also solved the problem of cost of goods, and attracted Yale and Mount Sinai in Connecticut and New York, New Jersey to collaborate with us in terms of treating patients now with this. We have an experienced team, and we're currently raising 15 to 30 million to generate the clinical data, and in between convertible notes to go into this as well. I've been involved in a number of companies over the years, and now 9 drugs which are on the market, including many of the drugs at Genentech back in the 1990s that were developed, Rituxan, Herceptin, Avastin, Lucentis, and Xolair, and also a number of products now that are on the market newly, actually, for genetic diseases, and also actually one of the first generation CAR T products of Beckman, Bristol Myers Squibb. And as I said, we're raising $15 million. We have a $3 million still left on a convertible note. That's a guaranteed convertible note, basically into the equity at a discount, has interest associated with it, and also participation rights. And this Series A, which will be the full amount, will be sufficient to actually achieve the rest of the work at Yale, and 20 patients in lymphoma and 45 patients in the solid tumors, melanoma, lung, and pancreatic cancer in our clinical trials people. And, we would expect then a liquidity event based upon the clinical data within about 3 years, most likely an acquisition, but possibly an IPO should the market gods come back in by that period of time. The team then includes me. I was the CEO of Bluebird Bio, and also was at Genentech, where I served in the core development teams for those drugs that we mentioned. I have a PhD in immunology from Yale and a master's in biomedical engineering from Brown. Srivatsa is one of our key scientists, and he spent a lot of time at University of Pennsylvania, a particularly great place for CAR T and TCR T work. Paul Abrams, who used to be CEO of Neorex, is a NCI and Yale-trained lung cancer specialist, who's been involved in managing clinical trials and also companies. Kuldeep Shah, who is the person at CRISPR, which was just recently approved for sickle cell disease, doing the quality control and release of that, also at Kite for their CAR T products, which are now part of Gilead, and developed FluMist, actually, one of the vaccines at AstraZeneca. And then, a number of other scientists in-house. We also collaborate with people such as Alexei Barasanev, Mike Horowitz, or Philip Friedlander at Yale and Mount Sinai, and a number of people at other institutions, including, notably Mark Better, who was the number 4 employee at Kite in terms of manufacturing. We have many patents in the field, 25 patent applications with issuances in major territories such as the US and Japan, among others. These are very broad, covering the RNA technology with the various uses I showed, as well as the microenvironment. Also, we have claims on the technologies we use to get the right cytokines and the right profile and phenotypes of the cells reproducibly. So those are filed very broadly. So really, in summary, we think that we're able to bring immunotherapy to all the patients with cancer, and really bring this unique modality in a very, very good way that solves many of the issues of current cancer treatments. We have exquisite specificity, multi-targeted to multiple antigens, and we open the tumor environment for potency. We have low toxicity with safety and very high quality and robust reproducible manufacturing. We're convenient because we can be done at an outpatient basis. No need to travel and live in a hotel next to the major cancer center anymore, or rather be home with your family. And finally, we're affordable, really priced comparably to the antibody drugs with 80% margins. So with that, I thank you for listening and happy to answer any questions.
All right. Thanks very much, Alfred.